Hello everyone, I'm Dr. Diron. Today I'm going to talk about a drug, a well-known drug that is known as statin. Statin, what do you mean by statin? Statins are HMG-CoA reductase inhibitors. What is that? Okay, we all know that to control our high cholesterol, we always start with the lifestyle dietary modification, but when we are unable to control that, then we go for the medication, and statins are one of the important medication that we prescribe. But before prescribing statin, we are supposed to answer some myths from the patients. What are those? We all know that statins are HMG-CoA reductase inhibitors. That is an enzyme that form cholesterol. The function of statin is inhibit the HMG-CoA reductase and block the formation of the cholesterol, especially which type of cholesterol? LDL, a bad cholesterol, as we all know about that, and it promotes the formation of the HDL cholesterol. Okay, so here it reduces LDL cholesterol. That's how it works, and that's how it reduces the risk of high cholesterol, reduces the risk of strokes, heart attacks, and etc. But some patients ask, like, do we have to take the statins at night? We all know statins. There are so many statins in the market: atorvastatin, rosuvastatin, lovastatin, etc. So many statins are there. Not all the statins that we are supposed to take at night. It's depend on the half-life. Usually, some statins have 3 to 6 hours of half-life. Some statins have 12 hours of half-life. But usually, we prescribe them at night. It's because at night it has more function. Because usually at night only our cholesterol production will be high. So during that night it's supposed to be fight and supposed to reduce that. But there are some other statins we can take at the daytime that your physicians will prescribe them. But while taking statins, we are supposed to consider some myths, some questions that patients always ask. The things that we have to consider statins. While taking statins, what are the foods that we are supposed to avoid? What are the side effects? What are the things that we have to monitor? This is the main questions asked from the patients. So when you talk about the statin, we should not take the statin with the grapefruits or the grape juice. It is very important. The other thing is, the statins have so many side effects, but the most worrisome, the most annoying side effects are statins induce myopathy. Patients, after taking statins, they complain about severe muscle, like it break down the muscle, but it is not occurring in all the patients. Some patients will have. So due to that side effects, we are supposed to reduce the dose, or we may need to change the other anti-cholesterol medicines such as niacin, fibrates, etc. So these are the important things that we have to consider. We are supposed to avoid with taking grapes and grapefruits. Second one is the most annoying side effect, statin-induced myopathy. The other stuff is, when we take statins with people who have diabetes, sometimes these statins interfere with the diabetic control and it increases the sugar level. Sometimes it is not occurring for all the patients. Some patients may have this side effect. So we have to monitor the dose. We have to monitor the diabetic sugar level. We have to adjust the dose. We have to change the medicine. It's depend on the patient to patients and depend on the physician. The final thing is, we have to monitor the liver function test, as well as it metabolizes in the liver. It makes functions. It works in the liver, so it may affect the liver as well as. So these are the important things that when we prescribe statin, we have to consider the dose, whether we are supposed to take at night or daytime. It depends on the statins. It depends on the people's lifestyle. Second one is, we should avoid grapes and grapefruit. The third one is, we always monitor for the side effects, especially statin-induced myopathy, and we should have a good control in diabetic people because it may increase the sugar level. The last one is, we have to monitor the liver function test. So hopefully this video is helpful. We'll see you next video. Thank you.